Estrogen plays such a huge role in maintaining our bone density. And so when we lose that, that's going to increase our chance. And so one way that we can mitigate that is, well, I guess two ways. One way would be through hormone therapy if you so choose and if you're a candidate for it. And the other way would be strength training. That's going to increase our bone density, not only strength training, but also plyometric training. So like jump training, even jump roping, holding onto a desk and jumping, a few times a day, that's going to stimulate our bones to get stronger.
Hello, friends. This is Dr. Nita Luanga. I'm here with my friend, Dr. Esra Shermadou. She is the founder of Sakina Health. And Sakina Health is all about having peace in your healthcare. Just before we started recording, I was asking her what the meaning of Sakina is. And I'm like, it's such a beautiful concept. Don't we all want to have peace and tranquility as we are becoming healthier, working on becoming healthier? So, Dr. Ezra, I'm so excited to have you on the show. Thank you for agreeing to come and talk to us. You are a treasure trove of knowledge and wisdom, and I'm so excited to learn from you. So before we get started, I wanted to tell us a little bit about your journey into medicine. Even your journey, I remember with one of our first conversations, your journey was not straightforward, but despite
No.
having a unique journey, you have so much to share. So please, I'm gonna hand the mic over to you. Tell us a little bit about your journey on how you chose to specialize in family medicine and also focus on obesity medicine, because not a lot of physicians choose that path, and I'm sure you
Mhm.
have a reason why you chose.
Yes, thank you so much for having me. I'm so excited to be here and to speak with you. I've been looking forward to this. So thank you so much. And yes, like you mentioned, I am board certified in both family medicine and obesity medicine. And it was a little bit of a journey to get here. And I think that's just part of life and learning from your journey, what you like, what you don't like, and that influences you. And so for me, a big part of my journey that influenced me was my personal experience with cancer. And that's kind of really influenced who I am today and how I practice medicine. And we'll kind of talk a little bit more about that a little bit later. But through my journey, strength training became a really big part of my healing process and also an important part of prevention for me. I took that up as well as nutrition too. And also learning about hormones because that was something that was affected by my cancer journey. And I didn't feel like I got the information that I needed from my healthcare team at the time, which was also a little bit difficult because I was starting med school at the time. And so I was moving around a lot. So learning about hormones on my own over the years has really taught me the importance of hormones, the effect that they have on our bodies, especially as we get older. And that really, really inspired me to focus on women's health, also men's health too, because hormones are just as important in men as well. But women can be a little bit underrepresented, especially with the WHI study. And so that really inspired me to focus on hormones, weight management, and really trying to inspire people to strength train because that is so powerful in our lives, not only physically, metabolically, but also mentally. And so all of that really has inspired me to where I'm at today. And I'm excited to actually be able to practice medicine in a way that I like and focus on things that I truly enjoy. And I think will really, really be proactive and helpful in preventing things rather than reactive and treating things after the fact.
Wow. Where do I begin? So many questions. So many questions. So I didn't realize you also focus on hormonal health. We'll see how much time we have in terms of asking more
Yes.
questions about that. Yeah, but I think you mentioned that your journey with cancer started when you were in med school. How did you navigate that? How did you even manage to finish med school? Because I think a lot of people would perhaps choose a different journey.
So I actually started right before med school. It was during undergrad. So I was 21, junior year. And that was kind of the year that I was supposed to be applying for or taking my MCATs and applying to med school. So that, postponed things a little bit, but it was definitely a challenging time. I had to cut back on my classes, which was devastating at the time. But we got through that. We got through the journey. And it was about a year of actual treatment, chemotherapy. I had to have a stem cell transplant as well too. So I was hospitalized during that time period. And so that was just the getting through the chemo part and the stem cell transplant. And then after that, of course, you've got a year of follow-ups and lots of appointments, and that continued as well too. And so I had a little bit because my timeline was a little offset because of my cancer journey. I did get my master's, and so that allowed me to at least do something in between med school and undergrad. But I got into med school kind of during in my first year of like actual recovery. And so I moved away, and I'll be honest, doctors are not the best patients, and I did not completely follow through with my follow-ups all the way, so don't do that. I was at a stable enough point where my scans were starting to be spread out, and I had seen like most of the specialists, but it did make follow-ups difficult because I was away for school and I'd come home on weekends or the holidays, and so that did affect things. But, because of my cancer journey, I did develop premature ovarian insufficiency. And so, for those who don't know, that's when you lose ovarian function at an early age. The definition is before the age of 40. And so, I was 21 at the time, or 22. And so, I saw a reproductive endocrinologist and was told I needed to be on birth control pills until like the age of menopause, which was, that he's at 51, 55. And that was kind of it. And I didn't understand why I needed to be on birth control pills. And to be honest, I didn't feel significantly different off or on them. And during med school and residency, it's hard to go to the doctors and it's hard to take time off. And so I would come off my birth control pills for months and months and months and months, maybe a couple years. And it was just kind of an off and on thing. And I just didn't think anything of it. And then, you go to med school and you learn about the WHI study and how bad hormones are. And I was like, well, I don't want to be on these things anyways. And so, like, I'm not motivated to stay on them. But I always found myself going back and just trying to learn more about premature ovarian insufficiency. And the guidelines that I would find, they were older guidelines. And so I always questioned, like, are these like updated? Are these out? Are they not up to date? And so, and I would see, I saw a couple GYN doctors in residency and in my fellowship year. And they were honest with me. They're like, we're not really too familiar with treating premature ovarian insufficiency. And so they were honest about it, but they did recommend that I be on birth control pills for hormone. But again, never really knew why, or nobody ever said why. And so it wasn't until 2023 when I came across a course that really focused on premature ovarian insufficiency and the importance of hormones and their effects on the body and what happens if you don't have them and you're at a significant risk of developing cardiovascular disease, dementia, osteoporosis. And we have hormone receptors all over our body. They affect all organs in our system. And so I took that course specifically just so I could learn about my condition, how to treat myself. But I fell in love with women's health and just really felt passionate about educating women on the importance of hormones and how we shouldn't be afraid of them and that we should just educate ourselves so that we can make informed decisions ourselves about whether or not we want to be on them or don't want to be on them. And if we don't want to be on them, and even if we are on them, what lifestyle things do we need to be doing in addition so that we can age healthily, gracefully, all of that? Because it's not just taking a pill and living your life. It's you can take the hormone therapy, but you also need to do all of the lifestyle things in order to better support longevity, live healthily, independently, and reduce your risk of osteoporosis or heart disease. So yeah.
Wow, thank you so much for sharing your journey with us. I can't imagine going through a similar journey. I just see somebody who's so resilient, who's persistent, who's determined. I'm really blown
Thank
away.
you. That's
So
very
much for
sweet.
sharing with us. And in terms of this course you took on hormonal health, you touched on the importance of lifestyle in addition to taking medications. How did this impact you? Is this where your journey focusing on obesity medicine and resistance training started? Or were you already athletic before and lifting weights
Mhm.
before? Tell us a little bit more about your journey into lifestyle medicine and why you
Yes.
encourage people to lift weights. I think some of my favorite videos are of lifting weights, and then on the side, there's like captions, and I really enjoy them. And I'm like, okay, I
Oh,
need to
thanks.
weight, go to the gym as well.
Yes. Yeah, so I never really started exercising or being active until my journey. I think it was the days of every single time I would have a chemotherapy session, I would be out for days just lying on the bed for like days in a row. and I felt like dead. You're just like lying there, and I would just long for movement. I just wanted the ability to have the energy to feel good, to be able to move. And I would get things in the mail from the Leukemia Lymphoma Society about the marathons and half marathons that they would hold to help raise money for leukemia lymphoma. And so I was like, okay, well, when I'm healthy, I'm going to run a marathon. And so during that time, on the days where I was feeling good, I started to do workouts at home, just videos. And honestly, I did pretty much almost the same videos over and over for like years in my room. And even in med school, I really focused on running. I took up running and the home workouts, and that's what I did for several years. And so I ran a half marathon during my master's, and that was enough. I was okay with that. It wasn't the marathon, but I was okay with the half. And so then I got into strength training in med school. There were some students who were lifting weights, and I went to a class with them one time, and I was like, I loved it. And I continued going, and then I went and I did my own thing. But I went to another gym and I got a trainer and started to lift weights. And I never thought I would be where I am today, but it's something that's just really stayed with me. And for me, it's such a huge mental stress reliever for me. After a long, tough day at work, you're mentally exhausted, you're just so tired. And the last thing I want to do sometimes is lift weights. But honestly, I feel so much better afterwards. It's such a huge stress reliever. And I think that's what keeps me going and puts me in such a positive mood too. There's so many benefits. And I knew because of my strength training or because of my history of POI that strength training was important to help prevent osteoporosis. And so that's kind of why I also started it too. And it wasn't that I started exercising and I loved it right away. It probably took me about a year and a half or a year before I really like fell in love with it and started noticing like the mental benefits of it. But I knew that it was something that I felt good after doing it, and I knew that the long-term benefits were important. And so I stayed at it. And I think our bodies are meant to move. And I think it's so important that we all get movement in. We live in a time where we're on our computers all the time, we're on our phones, everything is computer based, and we drive from place to place. We don't even have to drive to get our groceries and walk in the grocery store. We can drive there, they can put it in our car, or they can just deliver it to our house. The same thing with our food too. And so there's a lot of convenience built in, but that takes away from the movement that some people get on a regular basis. Some people grocery shopping is the only type of movement that they normally would get, and now they don't have to. And we see so many consequences in our health because of that. The rise in obesity, the rise in different metabolic conditions, cancers, so many things, and even anxiety and depression. A lot of mental health illness can be tied to lack of physical activity. We see so many benefits from movement, from strength training, aerobic training. All of this is important to incorporate in our lives for not only metabolic conditions and health, mental stress relief, but also important for aging. We don't want to get older only to live our lives sitting because we physically can't move, because our joints and our bones can't support our body weight, or we lose the ability to move in a certain range of motion. And so it's important just for aging so that we can live independently. A lot of us work throughout our younger years so that we can retire and do what we want, but you don't want to retire and then just spend it sitting in front of the TV. I think there's more to life than that.
Yeah, that is awesome. You touched on so many things that I have questions about, but I was laughing when you were talking about groceries being delivered. I'm like, I am so guilty of that. I don't even want to get
Oh,
it.
I am too. But see, the way I see it is like it's okay to do those things,
Uh,
but use the time that you're going to save from going to the grocery store to exercise or to do something health. So that's kind of the way I see it is like I don't have time to work here and this and do this and go grocery shopping. So let me have my groceries delivered so
mhm.
that that buys me time so that I can exercise, so that I can do these. So I'm all for I'm all for delivery, but don't use it as a way to sit and watch TV. Use it in a beneficial way for you. So,
Touche. Well said. Well said. That's very
yes.
practical. And for women especially, it can be a
Yes.
little bit tricky depending on, your family, your friends, in terms of doing the
Yes.
resistance training, and even, just the way we're conditioned in society. Like, I think
Hmm.
things are changing, but there's a certain aesthetic that women are like,
Yes.
oh, if I lift weights, I'm gonna look too bulky. I'm gonna look like a guy. I just want to
Yes.
do cardio. I know this is changing, but for women
Hmm.
who have been conditioned this way, and
Conditioned,
or their
yeah.
families are like I was a gymnast at one point in time, and my dad's like, "You're looking, I know he meant well, but he's like,
Right.
you're looking a little
Yeah.
muscular." I mean, like he wants his little girl to be happy to look nice. And
Mm-hmm.
my dad is lovely, but
Yeah.
it's just that
Yes.
probably a little bit leaner than many of my
Uh-huh.
kids. I was looking more like a little tomboy, and he's like, "Yeah, maybe I need to work so
Yeah.
hard." So,
Yes.
and just another story. Like one of my sisters was interested in joining the wrestling team. Both of my parents were like, my mom too was like,
Yes.
but at the end of the day, movement is movement. So what kind of tips would you give somebody, like even starting with us ourselves, like with our mindset?
Mm-hmm.
How should we be viewing resistance training? You touched on the point that it's good for strengthening our bones, especially as we get wiser.
Mm-hmm.
But like, what other benefits are we going to have? And like, what would you suggest we say to our friends and family members when they're discouraging us from going to the gym or pursuing resistance training?
Yes. Oh, so many good points. So, yes, just starting off from the mental aspect of it. So, there's a huge fear of getting bulky, and that many people, women, and some societies might view it a little bit more so than others. And it's considered kind of a manly thing. And women are afraid of getting bulky. And so, to that, I would say we have about 1/10 of the amount of testosterone as men. And so, testosterone is important for building muscle and getting that size and the strength in muscle. And so, the chance of you getting bulky is going to be very, very low. And it's a process too. It's not something that happens overnight. And so as you're exercising, as you're training, as you're building muscle, if you are lucky enough to get to the point where you are starting to feel bulky, you can always not stop exercising, but maybe you decrease the amount of sets or reps that you do for that. Let's say it's your upper body, you're getting bulk in your upper body. Okay, so instead of training your upper body maybe 3 times a week or whatever it is, you decrease to maybe once or twice a week, or maybe you just use slightly lower weights. So you decrease the stimulus that you're going to give your body to stimulate muscle growth. So you're still kind of hitting those muscles, just not as much or with a little bit less weight. So it's something that's controllable. Getting bulky is such a process that involves nutrition, strategic weights and reps, and it's a process that takes years. So it's not something that's going to happen overnight. So I promise, just get started and let's see where you're at first. And then it's can be discouraging when you want to do something and then your friends are kind of telling you shouldn't do it and discouraging you to do so. But to that, I would say maybe you can inspire them. So maybe you go and you start lifting weights and they see you, maybe a month or two later and you're looking better. You're expressing to them how great you feel in just everyday activities. So, like I can go to the grocery store and I don't need help, getting something off the top shelf, or I can load my groceries in and out of my car without difficulty. And it's getting so much easier. Just from everyday activities, you're noticing the benefits of strength training. You're noticing that maybe your joints aren't hurting as much as they were previously. And so maybe you can inspire them to start lifting weights too. So it can be a little bit tough and discouraging and might hold you back, but don't let it. You do your thing and they will be inspired by you.
Yes, that is so true. That is so true. And even talking about like joint pain, I was thinking about like during med school and residency, I was not as disciplined as you. I did not work out at all, and I lost so much sweat.
Yes.
And I remember when I became an attending, I put on a bit of weight. I was still like, nah. I'm like, I can eat whatever I want. Like I ate in residency.
Yeah.
It's not that easy. So I just started developing knee pain, and then I started lifting weights, and the knee pain went away. And I'm like, wow, this is legit,
Wow.
real. Like
Yeah.
our joints and ligaments need to be strong enough to support
Hmm.
our weight so we don't have pain. So
Yes.
that is legitimate.
The important thing with that is also like in women, we especially see it, after menopause is kind of when we see that steep decline in not only osteoporosis or in our bone density. It goes, we reach our peak bone density in our mid 30s, and then it slowly declines up until we hit menopause, and then we see a steep decline. And that's really important because that increases our risk for developing osteoporosis. And that's because of the loss of estrogen. Estrogen plays such a huge role in maintaining our bone density. And so when we lose that, that's going to increase our chance. And so one way that we can mitigate that is, well, I guess two ways. One way would be through hormone therapy if you so choose and if you're a candidate for it. And the other way would be strength training. That's going to increase our bone density, not only strength training, but also plyometric training. So like jump training. Even jump roping, holding onto a desk and jumping, a few times a day, that's going to stimulate our bones to get stronger. And so that's something that can be incorporated even just once a week, or depending on how, if you have like a plyometric training day, that can be once a week. But jumping, you can do that essentially. If it doesn't cause you much harm, you can do that every day. But that's important for our bone density as well. And so both of those forms of exercise. And then we also have the loss of muscle mass too once we hit menopause. And so we see a lot of what we call sarcopenia, which is when you lose muscle mass after menopause. And that's important not only for supporting our joints, but also muscle is metabolic tissue, which
Mhm.
means that it's important for our metabolism. So, number one, if you lose muscle, you're not going to be able to eat as many calories in order to maintain your weight. Your body's just not going to need more energy because you have less muscle. And the other important thing about it is that it's muscle takes up glucose from our blood. And so as we get older, with the loss of muscle, we do see an increase in insulin resistance, especially after menopause in females. And so if we build muscle, we have more muscle tissue, it's going to be able to take up glucose from the bloodstream, and that's going to help decrease insulin resistance, make us more sensitive so that our blood sugars aren't high in our blood. And so that's another important factor with muscle as we age. Another reason why strength training is important. Strength training and also just getting proper nutrition too, because you can't build muscle if you don't have the building blocks for it, which is essentially protein and calories. So that's important too.
Yes, yes, yes. You hit on such an important point that muscle is metabolically active, so we can
Mhm.
hit the same weight, eat more calories during the day, and not necessarily being
Yes.
fat.
Yes.
So that is awesome. And I think you also answered some interesting questions. For me as a geriatrician, we do
Hmm.
see, of course, as people get wiser, perhaps they start developing diabetes, or we have patients, I was just thinking of patients in particular, as they're crossing into the geriatric age, like my diabetes is getting worse, like what's going on?
Yeah.
You just give me the answers because they're not exercising, they're using muscle mass. So they're probably eating the same
Hmm.
calories, but not burning them because they've lost muscle.
Hmm.
Like, oh, this is, thank you for
Yes.
sharing that. This is a very important cue.
Yes, it is very important. Yeah, many people don't realize it. And it's like, I'm doing everything the same, but my diabetes is getting worse, or I seem to be looking fluffy, or even if the weight is the same on the scale, you just notice that you lose that tone, you lose that shape, because muscle's honestly what gives us the shape to our body. And so when you lose that, the fat, you can see the development of the fluffiness and the shape changes too. So lots of muscle does so much for our bodies, and I don't think that many people realize it.
Yeah, wow, wow, wow. That
Yes.
is fantastic.
Mhm.
That is fantastic. And I think we're going to be wrapping up in a little bit, but I want to talk to you a little bit about more nutrition. So you mentioned when people are trying to build muscle, they have to be very intentional about their diet. So do you have any tips as to how somebody can practically adjust their diet? So say they're like, okay, yeah, I'm on board. I'm going to start lifting weights. What else do I need to do? Can I eat the same diet? I want to put on muscle, but like what am I thinking about in terms of my diet?
Yes, good question. So diet is one of those things where, everybody, for everybody's, it's going to be a little bit different because everybody responds to foods. We all have different food intolerances and our gut microbiome. But when it comes to strength training, we all hear about protein, protein, protein. And that is very important because that is essentially the building blocks for building muscle, or one of the building blocks. So when it comes to protein, for those who do not eat very much protein on a regular basis, and that's kind of been the way that they are, it's important that you don't go from 0 to 100 overnight, because your body is not going to tolerate that. Your GI system is not going to be happy, and you're not going to be happy, and you're going to be like, oh, I'm done. Like, it doesn't work for me. So the key is to increase your protein amounts over time. So, and when you think about protein, it might be easier to try to eat things that are going to digest a little bit better. And again, for everybody, this is going to be a little bit different. But you can think about like yogurt, if that's something that you tolerate, that tends to go down pretty easily. People tend to digest it well as long as they're not like lactose intolerant. Milk, chocolate milk, those are good sources of protein. With chocolate milk, of course, it has some sugar in it, so you just have to be careful with that if you're diabetic or insulin resistant. Chicken chicken breast or turkey breast. Those are also lean sources of protein. Eggs, egg whites, those are also good sources of protein that tend to digest well. And then if you love meat, then there's certainly like red meat, trying to stick to the leaner cuts as well. But also if you're vegetarian, there's tofu, there's lentils, beans, all those are great protein sources too. So protein is one. And then the number two thing that I would say is fiber, making sure we get enough fiber intake in our diet. That's really important. Fiber is so good for digestion and just bowel regularity. And it also has a lot of health benefits too when it comes to our immune system. And as we learn more about the gut microbiome, we're also learning like potential effects on our brain and our mental health and our skin and many other benefits. So fiber is also important. Fiber comes with carbohydrates too, which are also important for fueling our exercises and also help building muscle too. So, but I would start with number one, protein, just trying to increase that bit by bit, and also fiber, increasing that bit by bit as well too. And also making sure we're getting proper sleep because that's also, that's important for muscle growth and getting that recovery too. So it's all the lifestyle.
Yes, thank you for sharing that. And also thank you for pointing out that fiber and carbohydrates are important, especially for exercising more. So I can imagine that there are people out there who are listening to us who are thinking, I want to work with Dr. Sharmadu. I need some help. This thing is complicated.
Yes.
How can they find you?
Yeah. So, in number one, yes, it's very complicated. And that's why having somebody to support you individually, because there's a lot of general plans online and they're not necessarily going to work for you. And that can hinder you and prevent you from moving forward. And so, getting individual help is certainly very helpful. And so, I am located in Dayton, Ohio. I do see patients via telehealth in Ohio, and we'll be expanding to other states in the US as well. But I do also provide a lot of information on Instagram, on YouTube and TikTok and Facebook as well. So, and it's all pretty much under my name, Dr. Esra Shermadou. And then I do have my lifting page that I'm really hoping to start posting some exercise routines as well on. And that is Dr. Esra's Got the Iron. And that's on Instagram. So,
I like that. Dr. Esther's got the iron.
yes.
Nice, 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 nice. So for those of us in the audience who would like to work with Dr. Sharmadu, we'll make sure that we have all her websites and her social media handles so you can follow her. Thank you so much for spending the time with us to share all
Yes.
this information, your wealth of information. There's still so many questions I'd love to ask you, so I'm gonna have to have you back. Would you like me to come back?
Absolutely. Yes, for sure. This was wonderful. Thank you for having me.
Awesome. Thank you so much. And to our audience, thank you for watching. Bye bye for now.